Healthcare reform. It's the talk of the town, if the town is Washington, D.C. But some possible reforms aren't being talked about at all, not officially, that is. The White House and Congress have kept the lid on one of the most controversial but popular options, known as single payer. It's a story the mainstream press has largely ignored. So just who has been getting the chance to testify before Congress? A quick look at this panel of witnesses appearing before the Senate Finance Committee tells you all you need to know. The Business Roundtable, the U.S. Chamber of Commerce, the Conservative Heritage Foundation, representatives of the insurance industry, including Blue Cross Blue Shield, all in favor, more or less, of the status quo. Progressive groups have been heard from, too. The Center for American Progress, the labor union, SEIU, Families USA, those who largely support President Obama's goal of a public health insurance plan to compete with the private sector. Hopefully, this competition would create a real market that would bring down costs. Once upon a time, a young Barack Obama thought single-payer was the answer. Listen carefully.
I happen to be a proponent of a single-payer universal health care plan.
That was State Senator Obama, who said there was just one big obstacle standing in its way.
We may not get there immediately, because first we got to take back the White House, and we got to take back the Senate, and we got to take back the House.
Fast forward 6 years. President Obama has everything he said was needed. Democrats in control of the executive and both houses of Congress. So, what's happened to single payer? For one thing, as president, Obama is now looking for consensus, peace among all the parties. There was a big powwow in Washington last week. The president asked representatives of the healthcare business to reason together with him at the White House. They came, listened, and promised to cut healthcare costs voluntarily over the next 10 years. Some of us looking on at this charm offensive, some of us who'd been around a long time, were scratching our heads. We've heard this call for voluntary restraint before. Way back in the 1970s, Americans were riled up over the rising cost of health care. As a presidential candidate, Jimmy Carter started talking about how the government would be clamping down.
We built a haphazard, unsound, undirected, inefficient, non-system, which has left us unhealthy and unwealthy at the same time. So we must plan and decisively phase in simultaneous reform of services and refinancing of costs.
When Carter got to the White House, the very industry that only a decade earlier had tried to strangle Medicare in the cradle seemed uncharacteristically humble and cooperative. You don't have to make us cut costs, they promised. We'll do it voluntarily. So Uncle Sam backed down, and you guessed it, pretty soon medical costs were soaring higher than ever. By the early 1990s, the public was once again hurting in the pocketbook. Now, Bill and Hillary Clinton, feeling our pain, tried once more.
Universal coverage has to be the bottom line, and do not let anyone tell you any differently.
This time, the healthcare industry acted more like Tony Soprano than Mother Teresa. It came after the Clinton reforms, with one of the most expensive and deceitful public relations and advertising campaigns ever conceived.
Find more you like in the president's plan?
Who could forget America's sweethearts, Harry and Louise?
Doesn't have the choice we want. Look at this. The government picks health plans, then we have to pick a plan from their list.
Paid for, of course, from the industry's swollen profits. As the healthcare business dumped the mangled carcass of reform into the Potomac, they said once again, don't worry, we'll cut costs voluntarily. Sure, now healthcare costs are rising 6% a year. Anyone with a memory could be excused for raising their eyebrows at these latest promises. But leaving nothing for granted, the industry is pouring big money into lobbying, more than $500 million last year alone, according to the nonpartisan Center for Responsive Politics. They're also shelling out megabucks for a publicity blitz and ads attacking Obama's public plan or any health care reform that threatens to reduce the profits from sickness and disease.
With Congress starting on health care, let's remind the politicians, Americans know what works.
This is from a group calling themselves Conservatives for Patients' Rights. They've been spending more than $1 million on ads like this in the month of May alone. They've hired a conservative public relations firm called CRC. You remember CRC, the same high-minded folks who brought you the Swift Boat Veterans for Truth, the gang who savaged John Kerry's service record in Vietnam. Just who runs Conservatives for Patients' Rights?
Let's have real reform that puts patients first.
The guy in the ads. His name is Richard L. Scott, an entrepreneur who took over 2 hospitals in Texas and built the largest healthcare chain in the world, Columbia HCA. In 1997, Scott was fired by the board of directors after the company was caught ripping off the feds and state governments for hundreds of millions of dollars in bogus Medicare and Medicaid payments. It was the largest such fraud in history. The company had to cough up $1.7 billion to get out of the mess. Scott got off, you should pardon the expression, scot-free. According to published reports, he waltzed away with a $10 million severance deal and $300 million worth of stock. So much for lower overhead. Rick Scott and other like-minded industry representatives have made their views known. Meanwhile, only a handful of expert witnesses in favor of the single-payer option have been allowed to testify in the many congressional hearings on health care reform held this year.
So, as temperatures cool, I want everyone to take another look at the plan we've proposed. There's a reason why many doctors, nurses, and healthcare experts who know our system best consider this approach a vast improvement over the status quo. But if anyone from either party has a better approach that will bring down premiums,
single payer,
bring down the deficit,
single payer,
cover the uninsured,
single payer,
strengthen Medicare for seniors,
single payer,
and stop insurance company abuses,
single payer,
let me know.
Single payer.
Let me know.
Single payer. Single payer.